We turn now to our in-depth report tonight. Federal health officials are among those trying to figure out a bizarre health scare in southwest Arizona, a cluster that appears to have origins in Asia.
Cronkite News reporter Laura Palmisano traveled to Yuma County to press health officials for answers.
Yuma, Arizona, known for its fertile soil, military history, and Mexican-American heritage. But what you may not know, a mysterious syndrome has entered this border community, with roots that trace all the way back to Southeast Asia. A disorder Julie Decker knows all too well.
Tingling in my toes. In the morning I had tingling in my toes. It's like, this isn't right.
While we were unable to reach patients in Yuma County, the Scottsdale woman agreed to tell us about her experience with the disease. Initially told that she had the flu, after 4 days of extreme pain, she returned to the hospital.
I knew something wasn't right, so to finally get a diagnosis was almost a relief.
Decker was diagnosed with Guillian-Barre Syndrome, a rare disease that normally affects about 1 in 100,000 people.
So when we got reports that there was this clustering going on in Yuma County, it was worth of us investigating because it's unique and doesn't really occur, that often.
So imagine the alarm Yuma County health officials felt this past summer when testing revealed 8 people in the county contracted Guillain-Barré, a rate 400% higher than the national average. Of equal concern, 17 people across the border in the Mexican city of San Luis Rio, Colorado also got Guillain-Barré, 900% higher than the normal rate.
That we tend to not see these clusters, at least in the United States.
Dr. Shakif Blada of the Barrow Neurological Institute is an expert in Guillain-Barré, an autoimmune disorder that causes muscle weakness and sometimes paralysis.
It's a version of Guillain-Barré called AMON, which is very rare and is usually described in Southeast Asia.
When we asked county health officials how the syndrome ended up in Yuma, they declined to interview on camera. But a public records request revealed that cases of Guillain-Barré were reported in South County, East County, and in the city of Yuma. According to a Centers for Disease Control official, the Guillain-Barré outbreak along the border was caused by Campylobacter, a common bacteria that causes stomach illness. Now, the outbreak has prompted local, state, and federal health officials to work together for the first time with the government of Mexico to investigate the cause. Early reports indicate the outbreak was caused by a water source, but officials at any level refuse to say more.
The investigation is still kind of ongoing in the analysis and some of the lab results, so we don't know the full story yet. That's still being worked on.
The good news for those living in Yuma County is that people can fully recover from Guillain-Barré, a disease Julie Decker says she would not wish on anyone.
It was hard, but I got through it.
And we've learned this cluster of Guillain-Barré has turned fatal. According to public health officials, 1 elderly Mexican man has died. Meanwhile, we'll continue to press on for more information about the source of the illness. Live in Phoenix, I'm Laura Palmisano, Cronkite News.